Don't forget to like, subscribe and share the videos.
The topic that we are going to discuss now is permanent disability certificate for sickle cell disease patients. Okay, so why is there a proposal to give permanent disability certificate to sickle cell disease patient, and what is the problem behind this proposal? That we need to know. A plan to issue permanent disability certificate for sickle cell disease patients who are above the age of 5 years has been stuck in dilemma between three union ministries. What are the three union ministries? Health Ministry, Social Justice and Empowerment Ministry and Tribal Affairs Ministry. Okay, so these three ministries are stuck in a dilemma for nearly 3 years. For what? It is about the issue of permanent disability certificate to sickle cell disease patients who are above the age of 5 years. And previously, SCD, that is sickle cell disease, was included in the list of disabilities under Rights of Persons with Disabilities Act of 2016, and after this, the Department of Empowerment of Persons with Disabilities has increased the validity of the disability certificate of SCD patients from 1 year to 3 years. But actually, SCD, that is sickle cell disease, is a lifelong disease, but they are giving this permanent disability certificate only for 3 years, which is again protested by many. Okay, but still they required a minimum 25% disability. This is the condition that they are giving. Okay, so only if the patients have minimum 25% disability, then they will be getting this certificate, which is valid for 3 years. Okay, so this is the condition at present. So how are these three ministries involved in this? Let us understand that in the next slide. The Ministry of Health and Family Welfare is the one which is in charge of setting the criteria and rules for the certificates. So they set criteria and rule for the certificate. Who? The Ministry of Health and Family Welfare. Next comes the Ministry of Social Justice and Empowerment, which issues the certificate. Okay, so they set criteria and rules, they issue. Okay, Ministry of Social Justice and Empowerment issues the certificate. Next, Ministry of Tribal Affairs advocates for the rights of SCD patients. Okay, so this is how these three ministries are connected to this particular concept of issuing permanent disability certificate to SCD patients. Next, the Ministry of Health and Family Welfare is expected to release a report on this particular issue by October 2023. So let us see what is happening in the future. Okay. Now, from exam point of view, from science and technology point of view, we need to understand about this sickle cell disease. Okay, so let us get into those details. Sickle cell disease is a group of inherited red blood cell disorder. So it is an inherited disease. Okay, and it is an inherited red blood cell disorder. Okay, in SCD, the red blood cells, that is erythrocytes, become hard and sticky. Okay, so the RBCs, red blood cells, become hard and sticky, and they look like a C-shaped farm tool called a sickle. So they become, so this is actually the structure, but then they become C-shaped hard structure, hard and sticky structure. Okay, it will be looking like a sickle. So if you see that in the picture, you will understand it better. So this is the general structure of normal erythrocyte, that is RBC, but these are the sickle cells, C-shaped. Okay, so when they move in the blood vessels, okay, be it veins or arteries, these red blood cells will be having a free flow. But when sickle cells are formed, they become hard and sticky, right? So they get attached to the walls of the blood vessels, thus they will block the blood flow. So this is how the problem is happening in sickle cell disease, and it causes anemia in people. What are the symptoms of sickle cell disease? These symptoms may vary, but there are certain common symptoms like chronic, in case of chronic anemia, it will lead to fatigue, weakness and paleness. Okay, so chronic anemia is one of the symptoms of sickle cell anemia. Next is painful episodes might happen. What are these painful episodes? They are also called as sickle cell crisis. So these can cause sudden and intense pain in bone, chest, back, arms and legs. This is called as painful episodes, and the other symptom is delayed growth and puberty. Okay, so these are the symptoms of sickle cell disease: anemia, painful episodes and delayed growth and puberty. These are the common symptoms of sickle cell disease. Next, what are the treatments that we have now? First is blood transfusion. These blood transfusions can help relieve anemia and reduce the risk of pain crisis, which we saw already. Okay. Next, you have a medication called hydroxyurea. This hydroxyurea can help reduce the frequency of painful episodes and also prevent some of the long-term complications of this disease, SCD. Okay, and it can also be treated, this SCD can also be treated by bone marrow and stem cell transplantation. If it is in advanced stage, then they can go for bone marrow and stem cell transplantation. So this is how the treatment is done for sickle cell disease. What are all the government initiatives that we have at present? Okay, first thing is National Sickle Cell Anemia Eradication Mission. Okay, it is a national mission, National Sickle Cell Anemia Eradication Mission, which aims to eliminate sickle cell anemia from India by the year 2047. Okay, so these statements you can use directly in your answer writing, or it may be asked in your prelims also. And the government released technical operational guidelines for the prevention and control of sickle cell anemia in 2016 itself, and there are integrated centers which have been established in 22 tribal districts for treatment and diagnosis of SCD, and the state of Madhya Pradesh has established something called as state hemoglobinopathy. Okay, they have established state hemoglobinopathy mission. Why? To address the challenges and screening and management of this disease. Which disease? SCD, that is sickle cell disease. And there is also an initiative called Anemia Mukt Bharat initiative. A question about this Anemia Mukt Bharat strategy was already asked in your 2023 prelims examination. So